a computer that takes data from several X-ray images of structures inside a human's or animal's body and converts them into pictures in a monitor. CT scan stands for computerized tomography. Tomography is the process of generating a two-dimensional image of a slice or section through a three-dimensional object.
The technologist begins by positioning you on the CT examination table, usually lying flat on one's back, on the side, or stomach. Straps and pillows may be used to help maintain the correct position and to hold still during the exam. If a conscious material is used, it will be injected through an intravenous line into an arm vein during the procedure. A scan of the lower spine may also be done after injecting conscious material into the spinal canal. This is usually below the bottom of the spinal cord during a lumbar puncture. This will help to detect tumors or locate areas of inflammation or nerve compression. Next, the table will move quickly through the scanner to determine the correct starting position for the scans. Then the table will move slowly through the machine as the actual CT scanning is performed. You may be asked to hold your breath during the scanning. When the examination is completed, you will be asked to wait until the technologist determines that the images are of high enough quality for the radiologist to read. And then, the CT scanning is usually completed in 30 minutes.
Though the scanning itself causes no pain, there may be some discomfort for having to remain still or for several minutes.
If you have a hard time staying still, or claustrophobic, or have chronic pain, you may find a CT scan to be stressful. The technologist or nurse may offer you a mild sedative to help.
Special considerations. Any woman who suspects she might be pregnant should tell her doctor beforehand. CT scans are not recommended for pregnant mothers because of the risk X-rays might harm the unborn baby. Patients who suffer from claustrophobia need to tell their doctor or radiographer beforehand. The patient may be given an injection or tablet to calm them down before the scan. Mothers should avoid breastfeeding their babies for about 24 hours after CT scan if an iodinated intravenous dye was used. The dye may pass into the breast milk. If you're breastfeeding, tell your doctor beforehand.
Preparing for the CT scan. Wear comfortable, loose-fitting clothing to your exam. You may be given a gown to wear during the scan. Metal objects including jewelry, eyeglasses, dentures, and hairpins may affect the CT images and should be left at home or removed prior to your exam. You may also be asked to remove hearing aids and removable dental work. You may be asked not to eat or drink anything for several hours before your scan, especially if a contrast material will be used in your exam. You should inform your physician of any medications you are taking and if you have any allergies, especially to contrast materials. Also inform your doctor of any recent illnesses or medical conditions and if you have a history of heart disease, asthma, diabetes, kidney disease, or thyroid problems. Any of these conditions may increase the risk of an unusual adverse effect. Women should always inform their physician or technologist if there is any possibility that they are pregnant. A CT scan will tell the doctor whether the patient has a tumor in his or her abdomen, whether any internal organs in that area are swollen or inflamed. It will reveal whether there are lacerations of the spleen, kidneys, or liver. As a CT scan can detect any abnormal tissues, it is a useful device for planning areas of radiotherapy and biopsies.
Kung may pasyente ako, hindi na ako ng cellphone. Walang gamito, hindi siya ba? Ito na, magkaroon siya. Nagpagbaw tayo. Ako, hindi ko hindi ko bayaran. Hindi naman ito may wala. No.
Dapat the close dani sir ang
Ang kuhan, CT scan na kuhan, 8 to 5.
8 to 5.
University.
Wala giti sa ka siya.
Kasi kami ng mga asal mga start scan. For example, brain. Ay. More na siya mag... ang sunti na. Pero pag scan na, paspas na siya. Wala. Kung pasyente, bilik ka hangan. Ang kanya, may ano yun.
Oh, kani.
Naku yung mga patients na yung coma nga ginagawa.
Pasagara.
Yung coma?
Oo. May siya eh. Hindi mo sabihin, hindi hangad ka kayo, anak. So, saan mo padungo? Hindi kayo, may kantong Diyos naman. Kaya lang, iba hangan. Para, ang slice daw ako.
Grabe kayo, pag-uyahan siya. Pag-uyahan natin.
Prepare 21 million.
Pag-uyahan station. Pag-uyahan station.
Ang isnitso, hindi mo bibigyan. Spiral niya siya, anak. While kaso ng pasyente, ang isnitso.
Ay, so galing. Susunod.
Oo. Naisitso, kaya spiral. Kaya wala kong spray nga. Nga ang liyak sa spray.
Ah, so kapatid ko.
Usually completed only visit.
The technology.
You better.
And the walls kept tumbling